and we're on the verge of opening it up. Again, the timeline is going to depend a little bit. We're going to obviously open it up as soon as we can. The timeline is going to vary a little bit depending upon the demand in the current group, those who are 65 years of age and older. So how are we thinking about underlying medical conditions? Here on the screen are the categories, the recommendations by the Rhode Island Department of Health of what an underlying medical condition looks like. The conditions include diabetes, type 1, type 2, lung disease. You can see a number of different types listed here, but I'll point you to the fourth bullet, which is in general, people with significantly decreased lung function. You can see this is also reflected in heart disease and kidney disease, where people with significant heart conditions, people potentially with chronic kidney disease, is that qualifies as an underlying medical condition. You can see in the fifth category here, it's classified as a person with a weakened immune system. Cancer, people on chemotherapy or radiation, people who have had or are waiting for a transplant, HIV/AIDS, sickle cell, people that have a disease that weakens the immune system, or people that take medications that weaken the immune system. I also want to say what's not listed on here is that we are currently discussing other groups as well. We know, for example, that people with obesity are at more risk of severe COVID and dying. So we are looking at expanding this list. I will say that nothing is final. We're still in the process. And the other thing that the other way that this is going to work is that people should ask their doctors if they qualify. So here's our